Well, the clinic was actually started by my wife, and she started this in 2002. And we wanted to make, this is our fourth clinic, so we wanted to make it a little bit more open, bigger, more dynamic. But we did this because we've always had the premise of never limiting rehab time for patients. So if they come in, they could be here for 2 hours, 4 hours, 5. We don't care. We give them what they want, what they need, and that's why the people I hire, like Anna and the other support staff, they have the same philosophy that we do. So it's a very family-oriented group of people. It's a very family-oriented style because we all work together. And but it's all orchestrated, honestly, because of what my wife did back in 2002, and I was the guy that she gave the opportunity to really see the patients. There's a variety from post-ops, pre-ops, pre-surgicals, back pain, chronic pain, somatic pain, pool therapy, aquatics. We do a lot of aquatics here because we have a SwimX pool which generates current to 10 miles an hour, so you can quantify a lot of the activities that they do. And then what you can do with that is you can tell insurance companies, hey, patient's doing better from A to B. The nice thing is with that kind of pool in this environment, you can do things with patients in the pool and on land, and actually, and you can spend hours doing it.
So always your first visit here, we always spend time and sit down with the patient and talk through what's going on, what brings them in, what they've been experiencing, and where their pain or maybe their limitations are. And then we also talk about their goals. So what they want out of therapy, what they want to see in their everyday life as well. So we can use that to help shape what we want therapy to be for them. Because we don't want to do a cookie cutter for everybody. We want to make sure that it's specialized per person, and that makes sure that the people are doing something that matters to them as well outside of therapy besides just what we can do and see in the clinic.
I would highly recommend exclusive physical therapy because of the care that not just Anna offers but Scott offers, because they work together as a partnership and they work together as a team as a whole to create a space where you can feel safe doing physical therapy but also cared for, not just as a patient or a number, but as an individual, as a whole person being able to move through your healing process.
Just getting to know Scott as a patient for 4 or 5 years, I can tell he thinks differently than other therapists do. He puts together your body differently. He understands why if something hurts based off of, say your hip hurts, he knows that your leg is weak and your foot's weak. Strengthen those up, strengthens your hip up, makes you feel better. Other therapists kind of only focus just on the hip, or other places I've been at least.
What I like to hear is the family atmosphere. It's very family oriented, and you just want to do it. It makes you feel better.
We cater to the people like most PT clinics will do, but my clinic, I like to make sure that if you need to be here for a while to get better, you will be. And if you need to come in, whatever time you need to come in, you can. I mean, there's a lot of times where patients will just show up and we'll see them because they're in pain. We truly care about your well-being fully, not just your shoulder, not just your back, but make sure you're healthy all over. And I'm one of those people that I don't mind seeing a lot of people, but I don't want people to wait. So I don't like waiting lists. I like people to be seen. And if you're hurt, you ought to be seen. So in my mind, you get them in right away.